Those long waits to see a doctor are already frustrating, and they could soon feel even longer. There's a recent jump in visa fees for foreign workers applying for H-1B visas to work in the United States. Now, this includes doctors as well. Industry experts say the fees are adding a new strain to a healthcare system already struggling with a major doctor shortage. NBC5's responds. PJ Randhawa shares why medical groups are pushing for policy fixes and how this could change the wait for your future appointments.
Think back to your last doctor's appointment. How long did you wait to get on the schedule?
About a month, yeah.
Well over 6 months.
So far, I'm waiting like about 63 days.
If you think getting a doctor's appointment is hard now, it may get worse due to new visa restrictions impacting new doctors coming into the U.S. The new H-1B visa rules signed into effect by President Donald Trump last September include a massive fee increase. The previous visa fee averaged $2,000 to $5,000. It's now $100,000. According to the proclamation, this will provide more opportunities for American workers in science, technology, engineering, and math fields. Now, hospitals or medical practices that sponsor foreign doctors pay the fees. So let's talk about why this matters to you. The American Hospital Association says its recent survey of member hospitals found nearly 65% of survey respondents who utilize the H-1B program report pausing, delaying, or limiting recruitment as a result of the new H-1B visa fee. And according to the AHA, of the almost 400,000 H-1B petitions approved in fiscal year 2024, just over 4% were for medical and health occupations.
So not a theoretical risk, but absolutely something that's creating concern.
Dr. Bobby McCullough is the president of the American Medical Association. According to the AMA and the Association of American Medical Colleges, the U.S. is on track to see a shortage of up to 86,000 doctors by 2036.
International medical graduates are critical to kind of filling that gap in care when we already have a physician shortage, right? And then, we have other things that are causing physicians to retire early because it is so troublesome to practice medicine in this country.
A possible solution is a bill sponsored by the AMA to exempt physicians and healthcare professionals from the $100,000 filing fee. Dr. McCullough says this bill, that's in the early stages, is essential to preserving access to medical care in America's rural communities.
The rural and underserved areas are the ones that tend to go unfilled if we rely just on U.S. graduates. And so to help the health of those communities requires international medical graduates.
According to the AMA, doctors on the H-1B visa are nearly twice as likely to work in rural areas than cities.
Those international medical graduates have to make a decision. Do I come here and risk having that fee not be paid and then losing this opportunity versus going somewhere else in the world that could use them also?
According to the president's proclamation, the new H-1B visa rules don't apply to doctors who are already in the U.S. on a valid status. PJ Randhawa, NBC5 responds.
Thanks to PJ.